With aging, it is common to have hip and knee wear and tear. But is it similar in sports? Let's find out. Hello fellow friends, I'm Erik Hohmann, orthopedic sports surgeon working at Burjeel Hospital Dubai. Welcome to the Hip and Knee series. Join me as we cycle away to learning the 4 W's of sports injuries. Episode 4, Part 1. Welcome to the 4th episode of the Hip and Knee series. Today I'm going to talk about articular cartilage or articular cartilage defects. So what is the articular cartilage? Every joint has a lining which allows us to move freely with no friction and no pain. This is the articular cartilage. It is made mainly of water, but also collagen and other proteins. As you can see in the picture above, this is a cross-section of the bone cartilage of the femur. In general, the cartilage is the white stuff up there and is approximately 4 to 6 millimeters thick. What is the problem with cartilage? The problem is that it is very poor in blood supply, it does not replicate or reproduce, and it does not repair itself in general. It also has no sensation. Treatment of these defects is still controversial due to the poor capacity to heal. They often result in osteoarthritic or degenerative changes of the knee. As you have just learned, cartilage does not have a blood supply, which means it cannot heal itself. So when it comes to treating cartilage defects, we have to bring blood to the defect. One technique that we have used in the past, not so commonly now anymore, is to abrade the cartilage down to bleeding bone, and the bleeding bone then supplies blood supply to this area, resulting in cartilage repair. Lately, we have been using a slightly different technique for large defects. With a first arthroscopy or keyhole surgery, a small amount of cartilage is harvested, which is then grown in the laboratory onto a scaffold, and the scaffold is later implanted into the defect area. Finally, you can use allografts, which is a cartilage bone transplant from a bone bank. You can replace entire large defects very easily. This has been done since the 1970s and has shown to be very good in the long term, and the survival rate is up to 70% over 10 years. If you have a cartilage defect, the most important treatment that can be done is by yourself. If you lose weight, the load on the cartilage will decrease significantly. The weight loss is hard work, but it will help you in the end. If you combine weight loss with exercise, that is even better. Thank you for watching the Knee and Hip series. I hope you learned a thing or two. We welcome you to make a comment or suggestions in the box below. And if you like this episode, please hit the like button. I'm looking forward to seeing you again at the next episode of Knee and Hip series. Cycle away.